when we talk about Lewy body dementia, we're talking about two kinds at least of dementia. One is Parkinson's dementia and dementia with Lewy bodies, which obviously have strong overlaps. And in terms of that broader group, Parkinson's is usually pretty easy. You see somebody with classic Parkinson's, they are responsive to dopaminergic agents, and maybe 2 years, maybe 10 years, maybe 15 years into the course, they start to have troubles with their cognitive function. Not typically so much memory, but processing speed, staying on track, organization. With that, you may see some of the psychiatric symptoms you classically link to dementia with Lewy bodies, such as hallucinations and false beliefs, delusions. Number one, I think it is important that physicians recognize that people with Parkinson's disease are at very high risk for developing dementia, and that it's different than Alzheimer's. They're not going to come in like your Alzheimer patient, where they look to their family and say, they brought me in because they think I have a memory problem. More often the patient, if you ask them, will say, yeah, I'm struggling now with my organizational skills. I get off track more easily. If they're still working, they may really have trouble at their job. But they're not going to have that classic memory, lack of insight stuff that you typically see with Alzheimer's disease. And many times they're hallucinating and they won't tell anybody because it's not bothering them, or they think it's the medication, that kind of thing. But I ask the patients, how's your thinking skills? Is this affecting your day-to-day life? Do you ever see things that other people don't see? Many of my movement specialist friends will tell me that if you ask, the patient will say, well, I think I see a shadow over there, and I look and there's nothing there. Or surprisingly, sometimes they'll say, oh yeah, I always see this little dog in the corner. And even the spouse will not know that they're seeing this. The other special link to both dementia with Lewy bodies and Parkinson's dementia, and Parkinson's for that matter, is this REM sleep disorder where people act their dreams out at night. And a lot of times the spouses will see it, but they don't realize that it's linked to a higher risk for these disorders.